ER doctors slash nurses slash professionals. What is something you saw in the ER that made you say, how the hell did that happen? Had a toddler come in for noisy breathing. Wasn't in distress and his numbers were fine, but it was a noise none of us had heard before. X-ray was clear. When doing a throat swab, the other nurse with me saw something shiny way in the back. We pulled out a long, clear straw wrapper. Had another kid come in with a tree branch stuck in his abdomen. The tree branch was so big it had smaller branches still coming out. Had a teenage girl come in, big round belly. Mom said she's pregnant. Kid insists she's not. 2 negative tests later, she confesses she hasn't crapped in 2 months. She required 2 surgeries to clear out all of her stool. How she never ruptured her intestines and gone septic is beyond me. Okay, for the last one, I feel like you hit a point after, maybe a week where you're like, I should probably tell someone about this. You hit a month, you should be taking yourself to the ER. You hit 2 months? The fact you aren't dead yet is astonishing. That's insanity. 2 months? How do you go through 2 months and not think, maybe I should get this checked out? That seems bad. Next story. EMT here. I got called to our local limited capability ER to transport a patient and a critical care team to a trauma center. I get into the ER and head over to the patient. The patient's room is a horrible mess. Dressings everywhere, blood on the ceiling and on the floor. Imagine any scene from any overacted movie where a medical professional yells, "Don't you die on me!" Like that. On the bed is lying an older woman with her leg exposed, and the doctor is doing some stitches on her shin. No biggie. The kind of thing you'd expect the doctor to spend 5 minutes on deciding if a band-aid was good enough or if it actually needed surgery. It completely failed to line up with the scene around them, like the housekeeping department was on strike or something. Anyway, it turns out this woman had banged her shin into the steps of a shuttle bus. Her husband then drove her to the ER closest to their house, 45 minutes away, bypassing 6 different hospitals, including the one we ended up taking her to. Apparently, when she walked into the ER, she said to the registration nurse, "I think I'm going to die." And the nurse responded with, "I think you're right." Turns out she was on aspirin and warfarin and some form of chemo. She had virtually no clotting factors, and the ones she had left were inhibited. So what for most people would have been an annoying bleed which would have easily been controlled with pressure after a few minutes was a very small, uncontrolled arterial bleed which sprayed everywhere. We got her down to the trauma center without any additional complications, but I had no follow-up from there. Next story. Me. Working night shift. In comes a dude with 4 cops and a crap load of restraints. He's naked, bleeding, and screaming. Great. Okay, so blood work. Sedate and figure out what the hell he took. The guy seems okay. Mistakes, as I recall them. Dude was not sedated but playing possum. No one thought to do pupil check. Releasing a full arm restraint and letting a new grad do the draw. Dude shot up, shoved the student nurse and started throwing crap. As I weighed in to try to calm him down, another mistake, another nurse comes in to do bad cop. This enraged him. I turn to tell off the new nurse and my back is presented to crazy man. Huge mistake. He picks up his IV pole and swings it like he's going for a world record and hits me across the back. I heard my ribs crack. I hit the floor, flipping around like a fish out of water trying to breathe. The cops come in to secure the dude and decide to stick him in a 24-hour monitoring. I'm still trying to breathe and coughing, which hurts a lot. So, lesson learned, do not turn your back on anyone. Next story. Nurse here. I once took care of a man with multiple gunshot wounds and required major surgical operation. It was odd because the man was not the person you would expect for that kind of wound. He was in his 90s. I was expecting a younger man thinking it may have been gang violence, but nope. He was shot in World War II with a bullet that splintered in his abdomen. He had bullets stuck in him from the war, but he had never had them fully removed. This explained the heavy-duty lead levels. Another miracle he lived as long as he did with all that. Probably the coolest patient I ever had. Next story. A tennis ball in the only place Reddit cares about when referring to ER stories. Was hilarious on the X-ray. There was also a degloved dong from a motorcycle accident. That was quite the surprise. There wasn't a lot of damage around the area other than that, so I wasn't expecting it. That is why you check everywhere, though. And a bonus story. Mid-20s woman came in acting psychotic, screaming about the devil, scratching, biting, hitting, getting naked, the whole 9 yards. We figured she was on drugs or something. Anyway, she starts to seize and some other concerning symptoms, so we do a CT brain scan. This was when I was introduced to neurocysticercosis, or, more simply, brainworms. Don't eat undercooked pork in Mexico. When they give you the medications to end the worms, the swelling goes down, but the dead worms stay put. Oh, great. Yeah, just worms in my brain forever. I feel like I'd try to remove my head for the rest of my life. You know what? Don't like how that sounds. Moving on. Next story. Nurse here. Had two brothers get into a fight over a girl, wound up repeatedly stabbing each other. They're brought in and put on side-by-side stretchers. The amount of blood was incredible. I was just sliding in blood. I could not get any traction under my feet. How either of them made it, I'll never know. Next story. My mom worked as a receptionist for this doctor, and he would often ask my mom to accompany him and other staff to this rural village in South Africa as part of giving back to the community. So one day this lady comes in and complains about her breasts hurting. The doctor begins to examine her, and underneath her breasts, there are worms coming out. People ran out of the room to throw up. She had to undergo surgery, and they found many eggs and etc. Okay, remember when I complained about the brain worms? This is somehow worse. Get these stories away from me. Ugh. Next story. Not me, my brother while in med school. Guy walks into emergency room with the handle of a butcher knife sticking out from under one eye. They x-ray him and find that, yes, the whole knife is stuck there, sticking into his skull. X-ray and neurological tests indicate that he was really lucky. Knife didn't do any serious nerve or brain damage. After some debate, they decide to pull the knife out, but it's really stuck. Eventually, they lay the guy on his back. ER doc takes off his shoe, climbs up on the gurney, puts his foot on the patient's forehead, and heaves the knife out. They put the guy on the ward, and the next morning, the cops show up to ask him about it. The guy says, "Never mind, I'll take care of it." Next day, while no one's looking, Guy gets up and walks out. For people who didn't show up for their yearbook photo, they substituted the x-ray of the guy with the knife in his head. Next story. A friend was doing med school placement in rural India. An old lady came in with abdominal and genital pain. When they examined her privates, they found tentacles going all over. And when they imaged her belly, they found the same tentacles. Turned out she had prolapsed her uterus and shoved a potato in as a makeshift pessary. It seems that is the perfect place for potatoes to grow a root system. The roots had grown out of her, as well as through her uterus into her abdominal wall. Okay, so remember the worms ones? How does it just get worse, man? Oh God, oh no. Next story. Nurse here. When I was a student, I had a patient brought in from their care home with bugs in their trach, which is a hole in their neck the patient breathes through. The paramedics said they'd suctioned around 100 bugs on the ride over. Next would have to be a woman who gouged out her own eye due to psychosis. She calmly walked into the ER and asked if someone was available to clean it for her. Next story. Teenager got into a fight with his brother, of course both drunk and over a girl. Brother smashes a glass coffee pot and stabs dude in the neck, sees blood and runs. Somehow he missed all the major vasculature in the neck. This was out in the bush, so I got to take this guy to the nearest major hospital with a trauma surgeon and vascular on standby. On the way, his mom calls and tells him he better not rat his brother out. He has a record. They get in a shouting match and he starts thrashing around. I take the phone away from him and tell him to lie still unless he wants to die. More morphine given. Later, CT shows he was a centimeter away from having a carotid nicked and dying. Next story. Had a guy rush in saying his brother had been blown up. He opted to drive him in because he foolishly assumed that it would be quicker and safer than calling an ambulance. Go out and get the guy out of the car, and he looks like one of those Looney Tune characters who literally just got blown up by a backfire from an explosion. We ended up having to put his armband on his foot because his hands were literally melting off his arms. Just a few bones here and there. Surprisingly, he was relatively calm and lucid. Endorphins are a hell of a thing. When we asked what happened, he said his oil tank in the truck exploded. Now, I don't like to generalize, but our demographic tends to dabble in the drugs scene, so we assumed it was a drug house casualty. Next story. Not in the ER, but up on the floors. Pre/post-surgical, etc. Did his post-op care, but saw his pre-op x-ray. A guy with an entire glass Coke bottle shoved up his butt. Said he fell on it in the shower. I remember him asking me if he was going to have scars back there, and I told him he needed to worry about ever having a normal bowel movement again. Pre-op. A very sweet older lady with a massive bowel obstruction. She was so impacted that she was spitting up fecal matter. Pre-op. A woman with an open sternal wound that was infested with bugs. There was so much pus, drainage, and necrotic tissue that her bra had adhered to her chest. She kept asking us what the smell was, and ma'am, it's you. It's you simply, slowly rotting away. Med/surge ICU. Had a young lady, a drug addict, in for stage 2 sepsis. She had a PICC line, a peripherally inserted central catheter, inserted, and her boyfriend obviously thought this was a normal IV. It's not. He shot her up with H, using that PICC line. And since the line is pretty much a direct route to her heart, she died instantly of an overdose. Had a guy get through the ER and up onto the floors only to pull out a .38 revolver and hand it to me. Thank God I am gun savvy, and thank God he didn't have a grudge against healthcare workers. Had another guy try to strangle me with my own stethoscope. He almost succeeded, I think. I was starting to black out when my male RN ran into the room and saved me. Edit. Also had the relief pitcher from a major baseball team come through. He wasn't wearing a cup and got hit in the groin by a line drive. He lost a testicle, and he looked so in pain that it made me cringe. I don't even have male genitalia. Next story. My boyfriend was the patient in one of these kinds of stories. So type 1 diabetes, 8-year-old boy who's had it since he was 5. Blood sugar got out of whack, admitted to the hospital. Kid had been getting his fingers pricked and insulin injected for years, so nobody thought he'd have a problem with getting an IV cannula in his arm. They were wrong. Apparently, one nurse staggered out of his hospital room with a visible sneaker print across her face. Another nurse got knocked unconscious, and it took nearly a dozen people to restrain and sedate this scrawny little kid. He still has a violent phobia of having needles anywhere other than his hands, and even then he usually needs sedatives. The only real exception is putting his insulin pump line in his stomach. Next story. As an EMTB was toned to stand by for PD to check a victim of an assault, we then waited 20 minutes to get clear to enter the scene. The patient had a bayonet in his skull. A goddamn for real bayonet. And Dover FD wouldn't allow their medic to cross the border for ALS support. With 2 hospitals the same transport time from where we were, we decided to transport to PRH, because they always have a neurosurgeon in the hospital. The guy lived, but he will always be brain damaged. The story made the newspapers in my area, and the guy that stabbed him is still in prison. Next story. I had a patient while I was in the AF who tried to take their own life by taking a rotating saw to his neck. When that was unsuccessful, how I still don't actually understand, he then wandered 3 miles into the woods hoping to just slowly bleed to death. Wife found the blood, called the base cops. We ended up finding him just wandering around in a daze. He lived. Craziest crap I ever saw. Ended up seeing him a few months later when he came into the facility for a follow-up and stopped in to see the ER staff that night. He was very apologetic and couldn't even remember why he tried to take his own life. Next story. I got a few, some too gory for this sub, so I'll share a moderate one. I had a kid come in with a lesion in the back of her head. Hair was a mess and she had 2 wounds. I immediately suspected violence. That was naive of me. I should have had that diagnosis by the smell alone. That was severe neglect, which can be far more damaging. I picked up my flashlight to better observe what was a yellowish-looking wound, and as soon as the light touched the wound, the kid started screaming. If anyone had washed that kid's head in the last 6 months, she wouldn't have had myiasis in her head. Just FYI, the final count was around 135 larvae. I, for one, hope this kid's parents, if you can call them that, never saw their child again. Who's with me? Too dramatic? I don't think so. Next story. Okay, first comment ever. Years ago, working as an ED doctor, had a dad bring in his 3-year-old daughter. They'd been eating pizza and she started choking. He opened her mouth and saw a red lump in the back of her throat, so he stuck his finger in and hoiked it out, followed by some fairly brisk bleeding, which had stopped by the time they came in. He brought this 3-centimeter diameter piece of meat with him in a handkerchief, but it didn't appear to be from the pizza. I had a look in this happy little girl's throat without a problem and, yep, only 1 tonsil to be seen. I've heard that tonsillectomies are like big deal procedures, and that things can go wrong. You're telling me this dude just did it analog? He performed the acoustic version of a tonsillectomy? Realistically, I know, probably not quite, some medical stuff or whatever needs to happen to, but like, come on. What the hell? Next story. My dad might qualify as one of these cases. I'm going to preface this with the fact that my dad did a lot of hard drugs at this time, his favorite being coke, which most likely contributed to the story. My dad had been in a car with friends when the driver drove off a cliff. Intentionally or unintentionally has never been specified when my dad tells it. Thanks to my dad's lack of belief in seatbelts at the time, he was thrown from the car, which caused his eye to pop out of the socket. The ER eventually got him and had to pop it back in. The eye in question is now a lazy eye, but he can still see out of it. I've seen pictures of my dad before this point, and it wasn't a lazy eye prior to this accident. Only after. Next story. A drunk redneck cutting logs with a chainsaw. He had the chainsaw still in his leg when he got here. It was stuck in his foot, in his shin, and in his calf. He was so drunk he was trying to get out of the wheelchair and calling everyone random slurs. Somehow, saved everything. A year later, his wife and her sister in the hospital. They had tried to start a bonfire with gasoline, poured it on the pile of wood while smoking. They exploded themselves and jumped into a stagnant pond. Burns in 90% of their bodies, and extreme infections. One lost a leg. Next story. Not a nurse, but I thought I would share. When I was 5, my dad got into a really bad accident on his moped involving a car that just wasn't paying attention. My mom worked at the ER but wasn't working that day. Obviously, they called her in, and I went with. The accident left my dad's elbow bent in the exact opposite way it was meant to be bent. I will never forget my dad's screams when they had to set it back the right way. Next story. I worked in A&D for a few days a few weeks back. We had this guy come into resus who had been drunk driving and crashed his car. He had then exited his car and run through a forest for about 50 meters before proceeding to fall 30 plus feet down a quarry. Fair to say there wasn't much of his skeleton which wasn't broken after that. Did have the cheek to ask whether he'd be going home that night when he first came in though. Next story. Really late to the party, but not in the medical profession. But I am a forensic psychologist who works in prisons. One guy was so imaginative with hurting himself that he's now used as an example in officer training. The one I'll never forget was when he used the plastic from a packet of Tim Tams to slice his scrotum, then patiently waited until his 1 hour per day time in the exercise yard to grab a fly and somehow managed to not let the officers see it, even though he was handcuffed hands and feet. He then inserted the fly into his scrotum and held the wound shut until his sack was crawling with bugs. Next story. My mom was an X-ray tech and told me a story when I was young, I think in an attempt to scare me away from drugs. It was about a homeless drug addict who couldn't find a vein to shoot up in, so stuck it in his dong when he broke the end of the needle off somehow, and it was lost inside. Also on an episode of Drugs Inc. on Netflix, they're in some South American country going to homeless drug addicts asking if they need medical attention. One of the guys said he was shot something like 3 or 4 years prior and never got it looked at. His intestine was hanging out of his belly. Nasty stuff. Next story. Had a middle-aged guy come in one evening and tell me that he'd been struck in the balls by a large pipe when it came loose from a workbench. It was busy, but I had a bad feeling about it and got him back to a room. I tell him to get on the bed and drop his drawers, and I can smell the blood. His balls were outside of his scrotum. I asked how he wasn't covered in blood, and he said he had driven home, changed, and only came to the ER after prodding from his wife. He went to surgery and was fine. No hard part damage, just the skin. So what was going through this guy's head? How did he think his body would resolve this problem by itself? Because I can tell you right now, I don't think it would have. Those are supposed to be inside of you, sir. Please help them stay there. Anyway, that is the last story for today. I'd rather end on that one than some horrifically gross one like we've had a lot of. Sorry about that. For now, though, thank you so much for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.